esteemed ladies and gentlemen. So our conversation begins today at the question on what is health. And more often than not, we are made to believe that as long as we do not have any diseases or any illnesses, we're healthy. But what is the truth? We know that the World Health Organization defines health as a state of complete health, a state of complete mental, physical, and social well-being, and not merely the absence of disease or infirmity. So what does this mean? This indicates that we can't just focus on the physical aspect of health, but must also include the psychological as well as the social aspects. So those are some of the things that I will talk about together with the physical health at this session. So looking forward, when we talk about the athlete, who is this person that we call an athlete? So if we're to look at the definition of an elite athlete, do we really have an elite athlete? Or do we also need to talk about our everyday athletes? Probably some of us fall in that category, those of us who do everyday activities. So unfortunately, we may not have a clear definition of an elite athlete. More often than not, we will look at people who compete at international levels. But again, what about the weekend warriors? What about people looking to achieve the recommended 150 minutes a week? So back to health. This is where we need to look at the short-term and the long-term health effects of sports. So if we will look, for example, if we looked at the short-term effects of sports, we will see that people engaging in sports are at a higher risk for injuries. However, and this is probably because nobody will pick an injury from sitting on the sofa, maybe perhaps. But again, we do not have studies that have looked at the comparativeness of injuries among people in sports as opposed to people who are non-athletes. And again, looking at the health term outcomes or effects of sports, we will find that generally people who are actively involved in sports have healthier habits. Why? Maybe because the main engagement is around activities that actually need them to be best at what they do at. So looking at people who we call or we look at athletes, we have seen that elite sports promote healthy behavior. For example, hardly will you find somebody who is an elite athlete smoking or having an unhealthy diet or engaging in excessive consumption of alcohol, and definitely they're physically active. It has also been found that many athletes train for at least 30 hours or 20 to 30 hours per week, far in excess of the recommended physical activity minutes, which is 150. So this plays a huge role in protecting them from a number of metabolic diseases, the diabetes, the hypertension, the metabolic syndrome, and eventually they end up having a lower risk for or rate for lifestyle diseases. However, there's a caveat to this. What happens to athletes when they retire and they cease to engage in physical activity? Maybe that is something else that we need to look into. It has been shown that we have had heart conditions in athletes. So what it is that went or did not go right? Maybe these are athletes who probably had a congenital condition that was actually brought to light by the presence of sports. And you know that sports will definitely exert a higher demand from the heart in an athlete. Looking at obesity in athletes, there's a possibility, for example, in one of my studies, I looked at rugby athletes in our country. And the surprising bit is that if we use the normal population measures, for example, what we call the BMI, the body mass index, I found that majority of our athletes are actually overweight and some obese. So the question lies, do the measures that we use for the general population apply to the athletic population? And if not, what is the normal for the athletic population? And it is the reason why we really need to look at the health of athletes. More often than not, when we see an athlete, we see the outcome, the performance at the end of that day. But what have they been through? What do they need to put in to be able to have that kind of output? So athletes and exercise is certainly maybe something that people enjoy, and maybe they're likely to probably push it a little further. And that is whether we will find that sometimes we will find symptoms of overtraining and or sometimes unexplained underperformance. And it has been found that 10 to 20% of athletes in the course of their career, and more commonly in endurance athletes as opposed to speed and power athletes, overtraining is common. However, the good news is with a good coach, it is actually possible to manage that. And further to that, these symptoms appear to resolve within 6 to 12 weeks of diagnosis. More often than not, the athlete is always out to look for the next big performance. How do we, using the health parameters, maybe not for the general population again, but health parameters that fit the athletic population, direct and guide these people so that they are able to perform through the seasons and through their career? So now when you look at mental health, we know that physical activity and sports are actually a prevention mechanism for majority of the mental health illnesses. However, we have seen a huge number or a good number of national and international athletes struggle with mental health issues. But again, it is not clear whether these mental health issues are more in athletic population compared to the general population. However, it has been shown that eating disorders are quite common in athletes. And for example, in the gymnasts. And this in return has been shown to contribute to what we call the female triad, which eventually has a long-term serious impact on the health and well-being of the female athletes. When we look at mental health, again, when these people who have been actively involved in sports, a time comes when they have to retire. Retirement could be either voluntary or non-voluntary. And non-voluntary, more often than not, is as a result of injury. So what happens at this point where somebody has been able to manage their life, they have had a consistent income-generating activity, and now they have to go into a sea of the unknown. Are they able to deal with the mental health issues and the pressures that come with it? Moving forward, how do the people in the athletic community manage issues of identity? This is somebody who was identified by what they did, or that is the identity they picked. So what happens after the glorious times are over or are done? Are they prepared to transition in from a face of glory to probably a face of, we don't know you anymore, we don't hear about you anymore, or for they themselves, what do they need to do? And this now brings in an aspect of social health. How does a typical athlete perceive their social enterprise or social community once they are in the athletic community and thereafter? And is there a transition mechanism that helps them link both of these? And this is where I call on to all of us to look at how we can actively lobby and advocate for health among athletes. And why do we need to talk about health among athletes? One, there is no normal for health parameters when it comes to athletes, because they cannot be compared to the general population. So what is normal for the general population may not be normal for the athletes. So how do we get what is normal for the athletes? And moving forward, other than having to look at the athletes from the performance point of view or from the performance part of what they do, how again do we bring this athlete, or how do we look at them as an individual who has health needs and who has health needs far beyond when they perform? And looking into that, how do we help them transition from one area of active performance to an area where they may need to go slower, probably not have much impact or not engage in much training? And again, how do we relate sports and health and have the two of them work together? As we are talking, we're looking at having universal health coverage. So what is the role of sports in achieving this national and global space or outcome of universal health coverage? What is the contribution of the sport industry? And is a sport industry only looking at the few elite athletes? And if so, where does that leave all other people who would like to be athletes but may not be at the global space? Thank you.